Hi everyone, my name is Ting Yin Ye. I'm gonna present research that my professor Dr. Smith and Dr. Lamont and I work together. The title is The Acute Effect of Heavy Squat and Foam Rolling on Vertical Jump Performance. So first, why do we do this? More general and athletic population start using a foam rolling as a way to immediate increase range of motion or relieve their muscle soreness and recover from exercise. There are some results documented in various research, including pain suppression, tissue relaxation, increasing joint mobility, and so on. Most of those effects were tested during non-fatigue and rested state. Also, there have had mixed results that researchers assess effect of foam rolling on metabolic by measuring the blood lactate. Predominant protocol applied in this area of research is evoking exercise-induced muscle damage. That damage might not happen immediately after training bout for athletes, but researchers want to know if foam rolling can attenuate decrement in performance after high-intensity exercise. And in our research, because we know fatigue might impact athletes' performance, therefore, we would like to evaluate the acute effect of heavy squat and foam rolling on several vertical jump parameters to see if foam rolling can have acute effect. And this is what we did. We recruit 17 university students, 4 female, 13 male. All of them completed familiarization session. They were told pros and cons of this experiment and fulfilled the consent and agreed to attend this research. Also, they were familiar with the warm-up and vertical jump procedure in the same day. The rest of 4 sessions, which including the control, the PAP, it's a squat, and foam rolling and combination. Each session were assigned randomly and separated 5 to 7 days. Participants should avoid strenuous workout or exercise for 24 hours before any each of session. From the figure 1, we can tell that all the participants went through the standard warm-up and baseline vertical jump procedure. They took 30-second rest between 2 jumps in the 1 set. And then the control and foam rolling group took 13-minute rest in sitting on the floor with leg extension. And squat and combination group performed 3 times squat. The weight is start from 60% to 85% of 1 RM. Next, each session perform 2 more vertical jump. So it's a J1, followed by either 4.5 minute rest. It's a control and a squat group, or 3 times 30 seconds of foam rolling for gluteal, hamstring, and quadricep. It's for foam rolling group and combination group. And then immediately do 2 vertical jump. It's a J2. So after that, the rest of the jump all have 2-minute rest between each set in all session. The vertical jump that precede the greatest height was used for statistical analysis at each time point. Results were expressed as percent change from baseline. When we repeated measurement, ANOVAs were conducted on each measurement: vertical jump height, impulse, reactive strength index, and eccentric rate of force development for J1, J2, J3, and J4. When statistical significance was achieved, post hoc tests used multiple comparison with Bonferroni correction was used. And then what we find for all the results, we compare percentage change from each baseline to J1, J2, J3, and J4. From the result, we can tell that only combination of heavy squat and foam rolling lead to significant difference when we compare with control group. It significantly impacts the impulse that produced in J2. The reason might come from combination of heavy squat and foam rolling may influence their force production or time spent producing force, and the foam rolling in an hour or two maintains similar vertical jump height produced during the other session. To sum up, in a period of foam rolling may have minimum impact on the fatigue induced in our current study. This result might be different if we extended the time of assessment post-treatment or increase the dosage of the foam rolling. Just like the other research, they're looking at what happened after a certain minute or 24 hours later. And after that, the result might be different. So now the presentation is finished. Thank you very much.